We're going to talk about a test that has become extremely popular, especially as more healthcare providers suggest it to their patients. And that test is Agar plate mold testing. We've all seen them. They're inexpensive, they're super easy, and they promise answers. But do they actually give you meaningful information? We will talk about that. You've tried everything. You've changed your diet, you've detoxed, you've even moved homes, and yet you still feel sick. Headaches, brain fog, fatigue that no one can explain. What if it's not you? What if it's your environment? Welcome to Mold, Mycotoxins, and More. I'm John Bodie. Each week, I sit down with experts uncovering how mold, mycotoxins, and environmental exposures affect your health and what real recovery looks like. Let's get into today's conversation. The information provided on the Mold Pros podcast is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. Listening to the podcast does not create a doctor-patient or professional-client relationship between you and the podcast host, guest, or the Mold Pros. The content shared should not be used as a substitute for professional medical advice, diagnosis, or treatment. And always seek the medical advice of your physician or qualified healthcare provider with any questions you may have regarding a medical condition, potential mold exposure, or health concerns. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. And while we strive to provide accurate and up-to-date information, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, or suitability of all the information discussed. And guest experience and outcomes discussed on this podcast are individual cases and should not be considered typical results. Your situation may differ significantly. As always, if you think you have a medical emergency, call your doctor or 911 immediately. By listening to the Mold Pros podcast, you acknowledge that you understood this disclosure. Welcome back to Mold, Mycotoxins, and More, the podcast where we break down mold, mycotoxins, indoor air quality, and how these things actually affect real people and real buildings. I'm your host, John Bodie, co-founder of the Mold Pros. This episode is part 2 of our 4-part series on DIY mold testing. In the last episode, we covered HB2 testing, what it is, how it works, when it's useful, and why those numbers are so often misunderstood. Well, today, we're going to talk about a test that has become extremely popular, especially as more healthcare providers suggest it to their patients. And that test is Agar plate mold testing. We've all seen them. They're inexpensive, they're super easy, and they promise answers. But do they actually give you meaningful information? We will talk about that. So let's start with exactly what is an agar plate. An agar plate is a petri dish that's filled with a nutrient gel designed to grow microorganisms like mold or yeast. There's really not much to the test. It's pretty simple to use, as I mentioned. You open the plate, you leave it exposed in a room, you close it, you wait a few days, and you see what grows. If mold grows, people assume there's a problem. And if nothing grows, they assume everything's fine. Well, unfortunately, that logic doesn't hold up, and I'll explain why. But first, let's start with some of the pros of agar plates. As I mentioned, they're low cost and they're easy to use. You can find them online. You can find them at certain labs that sell them and ship them out to you. You can find them at your Home Depot or home improvement store. The second pro, and I think this is probably really important, is seeing mold grow can be visually validating, especially for people who've had concerns and no one's listening to them. Their family members may think they're crazy or dismissed them. And seeing that little fuzzy growth on your new science experiment, it's definitely cool. It's a little disgusting, but it does offer some validation in that regard. The purpose, the third pro, the purpose of a agar plate really is to show viable molds, living organisms. Laboratories have used agar plates to grow molds for decades. There is an educational awareness component to it, is probably the fourth positive about an agar plate, and they can really help start a conversation. So those are the kind of the 4 pros of an agar plate and the value that they bring there. Now let's talk about the cons, and they're substantial. First of all, mold is everywhere. According to the CDC and the EPA, mold spores are always present in indoor air and outdoor air. So growth on an agar plate is normal. It is not diagnostic. Next, the agar plates don't measure exposure. They don't tell you what people are breathing in. They don't tell you how much they're breathing or how often they're breathing these things in. And the EPA and the World Health Organization are pretty clear. The exposure is about dose and duration, not random deposition. Third, the results on an agar plate can be really highly variable. There's things that impact it, the test results, such as airflow. Are there ceiling fans operating? Are the HVACs operating? If so, how much? How much air is getting circulated around? Humidity. If you listen to some of our other podcasts, we've talked about xerophilic molds like Aspergillus and Penicillium that don't need a water leak. They only need elevations of humidity to thrive. And so humidity can have a big impact on those results. The third item that has a lot of impact is placement. Where you put the agar plates in the room. Is it near an HVAC vent that gets things blowing on them or contaminants blowing on them? That could have a big impact on those results. And even something as mundane as foot traffic, that creates airflow issues just walking by it. So that can impact your results as well. Not uncommon to see two plates in the exact same room have completely different outcomes. And that's why agar plates are not used for professional assessments. Next, most DY agar kits, they don't identify the mold to the species level. They don't distinguish between low-risk molds or higher-risk molds. They don't detect mycotoxins. And so if you get that scary-looking colony growing in your Petri dish, it may be irrelevant, and a serious issue may never show up. So that's something to consider. And then here's a big one. Not all molds are airborne. According to the CDC and the EPA and other peer-reviewed research, molds like Stachybotrys chartrum, what people call black mold, they're heavy, they're sticky, and they're not easily airborne unless they're physically disturbed. They're primarily spread through water movement, insects, rodents, that kind of thing. You've cleaned, repainted, and replaced filters, and still, you're not getting better. Headache, fatigue, brain fog, the doctors can't explain it, but your environment can. At the Mold Pros, we specialize in uncovering what's hidden in plain sight. Our environmental testing looks beyond surface mold, identifying bacteria, volatile organic compounds, and even mycotoxins in the air that you breathe. Then we correlate those results with your clinical data, showing how your space may be affecting your health. Next, we use our patented remediation process to safely remove toxins, restore balance, and prevent them from returning. It's more than just a cleanup. It's a science-based system designed to help your body heal by healing the environment first. If you're ready to breathe freely again, visit themoldpros.com and schedule your free consultation. Because wellness doesn't start in the doctor's office. It starts where you live or direct contact with other contaminated building materials. So in theory, you could have significant Stachybotrys growth in a room and see little or nothing on an agar plate. It would give you a false negative. And that leads to the largest risk is either a false reassurance because minimal growth on an agar plate doesn't mean a building is safe. The EPA and the World Health Organization both caution against using passive sampling alone to rule out mold exposure. So I know it's a lot of information, but before we wrap up, here's the bottom line on agar plate mold testing. They have some positives. They're inexpensive, easy to use, and they can provide that visual confirmation that mold can grow indoors. And they may provide a little bit of insight if you're comparing rooms one to another. And as an educational tool, it's a good starting point to get a conversation going. But I think the cons matter a little bit more. Again, mold's everywhere. So growth on an agar plate doesn't necessarily mean there's a problem. And the agar plates don't measure the exposure or the health risk. And the results can vary widely, based on timing and airflow and placement and all those sorts of things. And these kits don't identify mold at a species level, so you don't know if it's a toxigenic or pathogenic fungal species that's there. You just see this fuzzy stuff. And you can send it in, it'll usually break it down to the genus level. It'll tell you if it's Aspergillus or Penicillium, but not Aspergillus fumigatus or Aspergillus flavus, etc. And again, they don't detect mycotoxins at all. So if you're concerned with mold toxins, this is not the test for you. And then some really important molds in water damaged buildings like Stachybotrys, they're not easily airborne. So you can get those false negatives as well. So, and the biggest risk, I think, is that false reassurance that, results look low when it's just a small portion of the equation. Fine, agar plates can start a conversation, but these should never be the final answer. They have a purpose, but it's not a great tool for measuring indoor air quality and diagnosing issues there. Testing should support an investigation. It doesn't replace one. So a good investigation is the first place to start. So in closing, hey, thanks for listening. I hope you found this episode helpful. If so, please leave a review wherever you're listening to your podcast. The reviews help the show reach people who are trying to make sense of the mold world without getting overwhelmed. And if you know someone who's confused on DYI testing, maybe they've had an agar plate result, they're not quite sure, please share this episode with them. I think it could be helpful. And coming up next in part 3, we're going to dive into ERMI testing, what it measures, when it's useful, and why these numbers often cause panic when taken out of context. I'm John Bodie, co-founder of the Mold Pros. Feel free to contact me at www.themoldpros.com or via email at info@themoldpros.com. You've been listening to Mold, Mycotoxins, and more. We will see you next time. Thank you. You've been listening to Mold, Mycotoxins, and More with John Bodie. If you're ready to take the next step towards a healthier home, follow the show and visit themoldpros.com for your free consultation. Because clean air is the first step to true healing.